Hello, my name is Jessica Eckhart, and I'm a professor of sociology and social justice at Northland College, and it's my privilege to welcome you to the first lecture of the semester on infectious disease epidemiology. Through a series of videos, I'll explain the fundamentals of epidemiology, including social determinants of health, disease transmission, and public health surveillance. And by the end of this unit, you'll have a deeper understanding of the natural and social factors that influence the spread and control of disease. First, some positive news. I'd like to start off with the recognition that during the last century, we've made vast improvements in responding to and controlling infectious disease outbreaks. While we're all sheltering at home and self-isolation during this pandemic, it may be easy to lose sight of modern public health and medical improvements. The discovery of antibiotics, vaccines, antivirals, and other treatments have significantly reduced the severity and scale of outbreaks and have largely shielded us from what we're experiencing today, which is living through a pandemic. Just less than 70 years ago, the world was battling simultaneous outbreaks of smallpox, measles, and polio. And these are terrible diseases that we are rarely exposed to today. Despite these advancements, infectious diseases are still a leading cause of death worldwide, with approximately 25% of annual global deaths occurring from well-known diseases like cholera and malaria to new infections like novel coronaviruses. And a basic understanding of infectious disease principles can help us make sense of our current predicament as well as future health trends. So let's jump in to some content. Many infectious diseases are endemic to an area, meaning they occur there regularly. Influenza, for example, is now endemic to the United States, and we can expect to see the number of flu cases increase seasonally every winter. COVID-19 will likely become endemic as well, which is why the development of a vaccine and effective treatment is imperative because this virus is not going anywhere. An outbreak or epidemic is when an infectious disease spreads rapidly to many people in a particular region. Recent epidemics in the United States include the 2019 E. coli epidemic, which originated from contaminated romaine lettuce, and the current outbreak of lung disorders associated with vaping. When an infectious disease transmits quickly across the globe and infects a large number of people, causing high number of deaths and socioeconomic disruption, it is considered a pandemic. In our modern memory, the scope of this pandemic is unparalleled, so this is truly a historic moment. As of April 23rd, it's estimated that 185,000 people have died from coronavirus thus far, and this number will likely increase until public health responses can reduce the spread. One public health tool that is used to help us understand infectious diseases and pandemics is epidemiology. Epidemiology is the study of the distribution and determinants of disease and health conditions within a population. So our focus is population, not individual level health issues. So let's unpack this definition in a little more detail by first describing the distribution of disease. In the next video, we'll talk more about the social determinants of health. The distribution of disease refers to the frequency and patterns of disease among a population. The frequency of disease describes how many people have the disease, which is often referred to as the number of cases. Using the 1918 Spanish flu pandemic as an example, it's estimated that the disease frequency was over 30%, meaning that 1 in 3 people worldwide were likely infected. This is over 500 million cases. We do not know the exact frequency of the 1918 flu because testing for influenza was not developed until years later. But during a pandemic, it is vital, imperative, that we test large portions of the population to determine disease frequency, because this allows us to assess how contagious the disease is. Once we have an idea of its frequency, we can take necessary precautions to slow the transmission. Unfortunately, as many of you may have heard, the COVID-19 pandemic has been characterized by testing shortages and inaccuracies, which has diminished our ability to characterize the scope of the infection and to make data-driven public health decisions. So accurate testing is also required to uncover any patterns. And remember, that was the second element of the distribution of disease, is identifying patterns associated with when and where the disease arises, and also who is more at risk of exposure. For example, are there seasonal or regional patterns to the disease? Are older adults and children more at risk? Are men more vulnerable than women? These are all characteristics we want to identify so that we can medically treat the population efficiently. One unique pattern, for example, of the 1918 pandemic that was discovered was that death rates were high for generally healthy populations like those between the ages of 15 and 40. In the case of COVID-19, adults over the age of 65 and those with pre-existing health conditions are at a higher risk of developing severe and fatal symptoms. So uncovering patterns such as these can help us form appropriate public health responses in the face of a pandemic. What we've learned from early epidemiological studies and past pandemics is that disease risks are not randomly distributed in the population. And this is really important. What this means is that some people are more likely to get sick and die from an illness than others. Learning about social determinants of health can help us make sense of inequalities in disease exposure and mortality. So be sure to watch the next video in this series.